Now, in the fifth and final section of our lecture, we will talk about the treatment of acoustic neuroma. And the two main methods of treatment which we will talk about in this section will be mainly the surgical options or surgical treatment of acoustic neuroma, and also we will talk about the radiotherapy of acoustic neuroma. So treatment of acoustic neuroma is surgery and radiotherapy. So two main options of the treatment of acoustic neuroma are the surgery and radiotherapy. The surgical approach, we have different approaches for the acoustic neuroma to remove the tumor by surgery, and what approach or what route is used to remove the tumor depends upon the size of the tumor. If small size of the tumor is present, the area we need to approach is not usually big. We don't need a bigger area to approach the tumor, so the different route is used. But if the tumor is bigger, and then we need bigger area to remove that tumor, so the different route is used. So mainly surgical approach depends on the size of the tumor. The different approaches present, we have middle cranial fossa approach. Middle cranial fossa approach is through the skull in the middle cranial region. Then we have translabyrinthine. Trans means labyrinth is the inner ear. So through the labyrinth we can approach the tumor also. Suboccipital. The occiput is on the back portion of the skull is the occipital region. So suboccipital is below the occiput. Then we can use combine translabyrinthine and suboccipital if there is a bigger area is required, so both combined approaches can be used. So depending on the size of the tumor, we can do different approaches. It can be middle cranial fossa approach, translabyrinthine, suboccipital, and combined suboccipital and translabyrinthine approach for the surgery. If you see the middle cranial fossa approach, this is the area that is through which the tumor is reached, middle cranial fossa. So just above the ear, we have middle cranial fossa. This is the site. Then translabyrinthine approach. This is the area which is used here, translabyrinthine approach. Suboccipital retrosigmoid approach. Suboccipital, this is the occipital region. So suboccipital, this is the site which is used, and close to this suboccipital we have greater occipital nerve and suboccipital craniotomy. This is the region. Craniotomy is the opening of the skull cranium to access the tumor. So suboccipital site. Then combined translabyrinthine suboccipital approach. Then in this we have suboccipital, and this is suboccipital region, and little bigger area can be accessed with this combined approach. Acoustic neuroma is present. This is the cochlea, cerebellum, brainstem. So this is the tumor. Next, after the surgical approaches, and depending on, I mentioned that depending on the size of the tumor, we decide which approach to use to remove the tumor. It can be translabyrinthine suboccipital, it can be middle cranial fossa approach or suboccipital. So, and sometimes we can use combined translabyrinthine and suboccipital approach. Next treatment option for acoustic neuroma is radiotherapy or treatment by radiation. It can be conventional type of radiotherapy, which is by external beam, and radiations are given to the area which has the tumor. That's the conventional method of radiotherapy. Then another method to give radiotherapy is by X-knife or gamma knife surgery, and then also cyber knife surgery. These have the ability to reach the area, only that limited area which have the tumor, and it can regress or shrink the tumor in that area. X-knife or gamma knife surgery, this is the gamma ray machine here, and it is giving the focused gamma rays to the tumor. This is the head frame, and then focused gamma rays are given, helmet, brain, and these focus radiations are given, or focus gamma rays are given to the area that has tumor. Stereotactic radiotherapy, radiation energy is converged on the tumor, causes arrest of growth of tumor and causes decrease in the size of the tumor. Used in patients who have contraindications to surgery or in those with residual tumor. So if surgery is not indicated, we can try stereotactic radiotherapy methods which provide the radiations to that area which has tumor, cause regression of the tumor. Done through linear accelerator and gamma knife through a cobalt-60 source. Cyber knife improvement over X-knife surgery, totally frameless. In this you can see is totally frameless and more accurate as compared to gamma knife radiotherapy. Uses real-time image guidance technology through computer control robotics. So that was all about our lecture, Acoustic Neuroma, in which we talked in detail about the overview of acoustic neuroma, what are the clinical features of acoustic neuroma, how it can be investigated, diagnosed, treated, and what are the different specialized investigation techniques that can be used to diagnose acoustic neuroma. Thank you for watching sqadia.com.